Reimbursement methodologies, must know for CCA. Good morning class. Today we are going to review reimbursement methodologies, which are essential for understanding how healthcare providers are paid. These concepts are heavily tested on the CCA exam, so it is important that you understand both the definitions and how they are applied. I will ask questions, and we will review the answers. Section 1 - Basic Concepts 1. What is reimbursement in healthcare? Reimbursement in healthcare is the process of receiving payment from insurance companies or patients for services provided. 2. What is a reimbursement methodology? A reimbursement methodology is the system or method used to determine how much a provider will be paid for healthcare services. 3. Why are reimbursement methodologies important? Reimbursement methodologies are important because they determine how providers are paid and influence how healthcare services are delivered and documented. Section 2 - DRG and APC systems, high priority. 4. What is the DRG system and when is it used? The DRG system is a reimbursement methodology used for inpatient hospital stays, where payment is based on diagnosis, procedures, and patient conditions. 5. What factors affect DRG assignment? Factors that affect DRG assignment include the principal diagnosis, secondary diagnoses, procedures performed, and the presence of complications or comorbidities. 6. Why is the principal diagnosis important in DRG? The principal diagnosis is important because it determines the DRG assignment and directly impacts the amount of reimbursement. 7. What is the APC system and when is it used? The APC system is used for outpatient services and groups similar procedures and services together to determine payment. 8. How is APC different from DRG? APC is used for outpatient services, while DRG is used for inpatient hospital stays. Section 3 - Other payment methods. 9. What is fee-for-service reimbursement? Fee-for-service reimbursement is a method where providers are paid separately for each service performed. 10. What is capitation? Capitation is a payment method where providers receive a fixed amount per patient regardless of the number of services provided. 11. What is prospective payment? Prospective payment is a system where payment rates are determined in advance based on classification systems like DRG or APC. Section 4 - Medical necessity and claims. 12. What is medical necessity? Medical necessity means that the services provided must be reasonable, necessary, and supported by documentation. 13. What is a clean claim? A clean claim is a claim that is complete, accurate, and free of errors, allowing it to be processed quickly for payment. 14. What causes a claim denial? A claim denial can be caused by incorrect coding, missing information, lack of medical necessity, or improper documentation. Section 5 - Compliance and errors. 15. What is upcoding? Upcoding is the practice of assigning a higher level code than what is documented, which is considered fraud. 16. What is downcoding? Downcoding is assigning a lower level code than what is supported by documentation, which can result in reduced reimbursement. 17. What is unbundling? Unbundling is reporting multiple codes for services that should be reported with a single comprehensive code. Section 6 - Application and critical thinking. 18. How does accurate coding affect reimbursement? Accurate coding ensures that providers receive the correct payment for services and reduces the risk of claim denials. 19. How does documentation impact reimbursement? Documentation supports the codes assigned and determines what services can be billed and reimbursed. 20. What is insurance maximization? Insurance maximization is the process of ensuring full and correct reimbursement by coding all documented services accurately and completely. 21. How can improper sequencing affect reimbursement? Improper sequencing can lead to incorrect DRG assignment or claim denial, which may reduce payment. 22. Give an example of how DRG can affect payment. If a patient is admitted with pneumonia as the principal diagnosis, the DRG assigned will determine the fixed payment the hospital receives for that stay. 23. Give an example of how APC affects outpatient services. If a patient receives a minor surgical procedure in an outpatient setting, the APC group assigned will determine the payment for that service. 24. Why must coders follow official guidelines? Coders must follow official guidelines to ensure compliance, accuracy, and proper reimbursement. 25. What is the relationship between coding and reimbursement? Coding directly affects reimbursement because the codes assigned determine how much the provider will be paid. To summarize, reimbursement methodologies determine how healthcare providers are paid. Accurate coding, proper documentation, and correct sequencing are essential to ensure full and correct reimbursement while maintaining